Hi, I'm Dr. Harry Oken for Columbia Matters. This month, we're going to be talking about ticks. And of course, with ticks comes our concern about Lyme disease. With me today is Dr. Jon Aucott. Dr. Aucott is an assistant professor of medicine at Johns Hopkins, and he also is the director of the Lyme Disease Center in Baltimore, associated with Johns Hopkins University. Welcome.
Great to be here.
It's terrific to have you. Every year we talk about ticks and Lyme disease. So first, let's just start off with how frequently are we seeing Lyme disease today in Maryland?
Maryland is one of the top states in the United States for the number of Lyme disease cases, and it starts this time of the year. June, July, and August is the peak season, and there'll be hundreds, if not thousands, of cases of Lyme disease in these 3 months across Maryland. Howard County is one of the bigger counties. We've looked and surveyed at cases of Lyme disease, and it's in the top counties as well. So there will be many, many cases of Lyme disease with the acute phase in the next few months. The acute phase being the skin lesion, the rash that follows the tick bite that's infected with the Lyme disease bacteria.
I'm glad you mentioned about the rash, which is a target rash. We call it erythema migrans. It looks like a target. The surrounding circle is red, and then the center clears, and it can expand, but it doesn't always occur at the tick bite, correct?
So the round red lesion of Lyme disease often looks like the target, like you'd see on the side of a Target department store, but not always. Sometimes it's just uniformly round and red. But what's true is it's always round or oval because it does occur at the site where the bacteria enters the skin, where the tick bite was. Now it can spread from there. If it's not treated, it can spread to other areas of the skin, and you can get multiple skin lesions. But the original skin lesion is at the site of the tick bite.
And what percentage of people who have Lyme disease either remember having a rash or don't get a rash at all?
To our best knowledge, we think about 70 to 80% of people will see or know that they have that skin lesion, which means 20 or 30% won't have a skin lesion. They'll just have kind of a summer flu-like illness, fever, chills, achiness, feeling like they're down with a summer kind of virus.
Right, which is a great point in that if you feel flu-like and you've had exposure, remind your doctor if he or she doesn't ask, hey, could it be Lyme disease?
Yeah, especially these coming months, June, July, and August.
Right. Now, back to the ticks in Howard County, we principally have the deer tick here, although occasionally we see dog ticks, which do not actually carry Lyme. They carry other things. What percentage of ticks possibly have Lyme disease here?
So the deer ticks, the Ixodes ticks, most surveys have shown that anywhere from 30 to 60% of the ticks will be infected with the bacteria. The bacteria has a long name, Borrelia burgdorferi. So approximately 50%, which means there's a good chance that a tick bite does carry the bacteria.
Right. Right. And how long does a tick have to feed on you to actually increase the likelihood of transmission from the tick to us?
That's right. The transmission takes a while because the bacteria has to get from inside the tick and then into the skin. And so that process usually takes about 48 hours. That's why not all tick bites cause Lyme disease. If the tick is found early and pulled off before that window of 48 hours, then the chances of getting Lyme disease are markedly diminished.
Now, if you're bitten by an infected tick and it fades for 48 hours, what is the incubation period from the time you've been bitten to the time you may see clinical disease?
The typical incubation period is anywhere from 3 to 30 days. It's a big range, but the typical is actually about 7 to 10 days.
Okay.
So it's that week or two after the tick bite to be vigilant, either for a fever and viral-like illness or that expanding round red circle of skin inflammation that occurs at the tick bite.
Right, right. So now, once you're bitten, okay, and once after you contract Lyme disease, all right, you go to see your doctor, and what would happen? What would you expect would happen at most visits with the physician?
So if you're lucky enough to have the skin lesion, what ideally would happen is the experienced clinician would look at the skin lesion, realize that you live in an endemic area like Howard County, it's June, and it's a clinical diagnosis at that point. From experience or looking at textbooks, they'd look at the skin lesion and say, that's it, that's the Lyme rash. rash. If you don't have the skin lesion, then it's a little more complicated, because then we rely on both the clinical impression, but also then confirming with blood tests. And the key thing about blood tests early in Lyme disease is that the initial blood test may be negative, and it may need to be repeated 3 to 4 weeks later if the first one's negative. So we hope that the patient and the clinician find the rash, because that's the easiest way to make the diagnosis.
Right.
In that case, you don't need the blood test. The diagnosis is made based on the appearance of the rash.
Right. So typically, then, if somebody comes in and says to their doctor, I've had a tick bite, I want a blood test.
So that's a scenario where the initial, first of all, recognizing most tick bites don't result in Lyme disease. Right. So already the chances of the blood test being positive are quite low with any random tick bite if the person's not sick. So if they're not sick, actually some people would say not to do a blood test unless the person gets sick. Honestly. Other people would say, well, we could do a blood test, but remember I've said you got to repeat it then in 3 to 4 weeks to make sure that the initial test isn't a false negative.
Right. And it would probably take, the way most immune systems work, at least 2 to 3 weeks before you'd even be able to catch the reactive antibody to Lyme. Is that correct?
That's correct. These tests are based on the immune system production of antibodies, and it takes 2 to 4 weeks for the immune system to make the antibodies.
Now, once we made the diagnosis and they get treated, let's talk a little bit about treatment. Typical treatment is usually doxycycline.
For adults, we recommend doxycycline, correct.
And it's usually 100 milligrams twice a day.
Correct.
And let's talk about duration of therapy.
The range of duration is anywhere from 10 to 21 days for acute, uncomplicated Lyme disease. So early diagnosis, appropriate diagnosis, uncomplicated disease would be 10 to 21 days.
Now, sometimes Lyme disease causes neurologic complaints, cardiac complaints, etc. So if somebody presented with the neurologic complaint that we often see here in Howard County, which is a Bell's palsy, and they've presented with that, how would they be treated?
So they would be evaluated and treated slightly differently. If the Bell's palsy was associated with signs of meningitis, like a stiff neck or changes in thinking or concentration, then most authorities would recommend doing a spinal tap to exclude meningitis. The reason for that is meningitis is treated a little differently by most neurologists with intravenous antibiotics. So the diagnostic evaluation changes a little. We look for meningitis, and if we find it, then we often treat with intravenous antibiotics instead of the initial oral therapy.
But if somebody comes in, let's say, with a straight Bell's palsy, and they've had a tick bite, so you're thinking Lyme, and maybe at that time you're going to do a test, would there be a group of patients that would do well just by getting oral doxycycline for a month?
Correct. Patients that don't have signs of meningitis will often, the majority of the time, do quite well with oral doxycycline.
Great, great. So we've talked about clinical appearance, we've talked about treatment, we've talked about diagnosis. Now let's talk about prevention.
It's very important because we want everyone to enjoy the out of doors, but we want people to take precautions just like when they drive a car, you take precautions. So there's two main types of precautions. One has to do with minimizing the exposure to the high-risk environments. So that means when you go hiking, staying on the middle of the path, not running into the high grass where the ticks are often feeding. It means wearing protective clothing, long pants that keep the ticks off of you. And some people choose to use a compound called permethrin to treat their clothing. This is what the military does, and that actually kills ticks that get on your clothing and appears to be quite safe. So that's called personal protection. And then with that, also when you come in from the out of doors, doing tick checks, both looking and feeling for ticks, and also understanding the places ticks like to go. So ticks like to hide. They like to go behind your knee, in the groin, in the armpits, in the back, places where you won't see them. So it's searching out ticks in those high-risk areas like behind your knee, and both looking and feeling, realizing they're quite small. So a nymph stage tick this time of the year that transmits Lyme disease is about the size of a poppy seed. So some people feel it's actually easier to feel them than it is to see them because they're no bigger than a freckle. And so it's doing that tick check at the end of the day as well.
Well, there are two other topics I want to talk to you about. The first is oftentimes when people get bitten by a tick, even if it doesn't contain Lyme, they will have a mark and that mark is probably due to the proteins injected by the tick to get into your blood.
Correct.
Could you talk a little bit about how to help people distinguishing that tick bite from Lyme rash?
Yeah, so that tick bite mark is less than the size of a dime or a quarter, and very importantly, it doesn't grow over time. The rash of Lyme disease grows over time, typically expands a centimeter a day, so they get quite big over a week or two. They can be 5, 10, 15 inches in size.
Right.
If it's Lyme disease, if it's not Lyme disease, that tick bite reaction never gets bigger than a quarter.
And sometimes when you feel it, you'll even feel a hard area.
Yeah.
It's a little, what we call indurated, right?
That's right. And they can last quite a while, though.
Yeah.
They can last weeks, sometimes even a month. So it's not that they last, that's not worrisome. It's when the surrounding redness starts to expand day after day.
Right, right. And then, of course, the last thing is we are so fortunate to actually have the Lyme Center in Baltimore, because if somebody gets a tick bite and wants the Lyme Center to be involved, tell them how they can be involved.
Absolutely. So the Lyme Disease Research Center was started in the Division of Rheumatology at Johns Hopkins about a year ago, and it was formed in response to this expanding epidemic of Lyme disease. We're actively engaged in many areas of research. We're looking for better diagnostic tests. We're looking for better tests to predict who might remain ill after their Lyme disease has been treated. And we're most importantly looking about how to help people that can remain ill sometimes after their Lyme disease has been initially treated. The research center is really based around recruiting patients for our studies. And our main study that's important this time of the year is our study that looks at people with the rash of Lyme disease. So we're actively recruiting patients that have the rash of Lyme disease. This is a Johns Hopkins approved study and can be accessed through our hotline at the Lyme Disease Research Center, which we can provide.
And so if somebody wants to be seen, you'll see them.
We'll see them. If you've got a rash after a tick bite, we'll see you.
Great, great. Well, thanks for being here today. And I think we've learned a lot, and I think our viewers will benefit. This has been Health with Dr. Harry Oken.